Hello and good morning, dear students. So we have started the clinical classes, as you all know. So yesterday we talked about the fetal skull, and today we'll be talking about the female pelvis. So it is important to know about the female pelvis. Only then you will be able to understand and know how normal labor occurs and able to explain it. So let's start with the female pelvis. So here we have the female pelvis, and whenever we talk about the pelvis, you hold it in anatomical position. The female pelvis is basically made up of four bones: the two hip bones, right, or the innominate bones, the sacrum and the coccyx. So these are the two hip bones, this is the sacrum, and this little thing is the coccyx. So now this hip bone or the innominate bone is further made up of three bones. First is the ilium, second is the ischium, and third is the pubis. Ilium, ischium and pubis. Now these are three fused bones that together form the hip bone. Then here you have the sacrum, that is formed of the sacral vertebrae and the coccyx. Now if we talk about some landmarks that you should know about, if we talk about the hip bone or the innominate bone, this concave portion is the iliac fossa, right? Then here you have this, the anterior superior iliac spine, anterior inferior iliac spine, the iliac crest, that you can feel when you put your hands on hips. Then if you look posteriorly, here you have posterior superior iliac spine, posterior inferior iliac spine. Here you have the greater sciatic notch through which the sciatic nerve and the vessels pass. Here you have the lesser sciatic notch through which the other nerves pass. And then here this is the acetabulum, in which it receives the head of the femur. Here you have the obturator foramen, and this you have is the ischial tuberosity. This is the area on which you sit, and this is the pubic crest, and this is the pubic symphysis. So if we talk about the sacrum now, this is the fused vertebra, sacral vertebrae, right? Then here you have this concavity, this is known as the promontory of the sacrum or the sacral promontory. These auricular shaped structures or the air shaped or the wing shaped structures are known as the ala of the sacrum, right? And the posterior surface of the sacrum is all roughened because it receives various muscular attachments over here. You can see the foramen that are present here, and these foramen, they allow passage of nerves and vessels to supply the pelvic organs. Then you come to the pubic bone. Here the pubic bone, these two pubic bones, they are joined in between by a cartilaginous structure which leads to formation of the pubic symphysis. So two pubic bones, they join in middle with a cartilaginous structure forming the pubic symphysis. And now these are the bones that I talked about, four bones, and let me tell you about the joints. You have a pubic symphysis formed by the two pubic bones and a cartilaginous structure forming the pubic symphysis. Then you have sacroiliac joint. See this sacroiliac articulation or sacroiliac joint. These are two sacroiliac joints, and then one you have a sacrococcygeal joint where the sacrum meets the coccyx. In females, it becomes mobile during pregnancy because of release of certain hormones, and the coccyx can be pushed a little backwards to make more space. So this was about the bones of the female pelvis, the four bones, the various joints, and the landmarks that you should be aware about. Now let us come to the pelvis in particular. So whenever you explain pelvis, the pelvis is divided into two. First is the false pelvis and second is the true pelvis. Now what is the false pelvis? The false pelvis is the area that lies below this area, below the brim. This is the brim of the true pelvis. So the area that lies above this area is known as the false pelvis. So this all is the false pelvis. So what is the false pelvis made of? It is made of laterally by the iliac fossa, posteriorly by the lumbar vertebrae, and anteriorly by the anterior abdominal wall, right? So false pelvis, that is present above the brim, and it is bilaterally formed by the iliac fossae, lumbar vertebrae, and by the anterior abdominal wall. It does not have any obstetric significance, and it just helps in accommodating the growing uterus. So that is all about false pelvis. So of clinical importance is our true pelvis, right? So the area that is present below this is all true pelvis. So when you talk about this true pelvis, the area that is present below the false pelvis, it is divided into various areas. So first you have the brim, right? Then you have the inlet. After that you have the cavity, and then you have the outlet. So false pelvis, inlet, cavity and outlet, right? So now first of all what they ask you mostly is the what is the boundary of the inlet or boundary of the brim. So boundary of the brim is this area. See, the one which I am touching with my finger, this is the area formed by the which forms the brim or the boundary of the inlet. So how do you remember this? Remember, the first you have to finish the P structures, then you finish the I structures. So what I have asked you to do is to make a small mnemonic which is like SCTL, that is sensible, care, tender, love. SCTL, sensible, care, tender, love. So S is for the symphysis, C is for the crest, T is for the tubercle, L is for the line. So first finish the P ones. So you start with pubic symphysis, S, sensible, then pubic crest, SC, sensible, care, then T, tubercle, pubic tubercle, then pectineal line, then iliopubic eminence, iliopectineal line, the sacroiliac articulation or the joint, the anterior border of the ala of sacrum and the sacral promontory, right? So it will continue similarly this side. So how do you remember it? Sensible, care, tender, love. So pubic symphysis, pubic crest, pubic tubercle, pectineal line, iliopubic eminence, iliopectineal line, sacroiliac articulation, anterior border of the ala of sacrum, sacral promontory. So this forms a boundary of the inlet of true pelvis. Now we are talking about the inlet. So whenever we have to explain the inlet, the cavity or the outlet, what we need to explain is the diameters, because you should know what diameters are present in the pelvis and how the baby could accommodate in those diameters in various presentations. So whenever we talk about the inlet, we need to talk about the anteroposterior diameter, the transverse diameter and the oblique diameter. So this is the anteroposterior diameter, this is the transverse diameter and this is the oblique diameter, right? So first let us start with the anteroposterior diameter. Now this anteroposterior diameter of the inlet, whenever you explain, you need to explain three diameters, right? So first diameter is known as the anatomic conjugate or true conjugate or conjugate vera, right? Anatomical conjugate, true conjugate or conjugate vera, they all are same. The second AP diameter is the obstetric conjugate and the third AP diameter is the diagonal conjugate. So now let us start with the anatomical, true or the conjugate vera. Now this is the diameter between the upper border of the pubic symphysis and the midpoint of the sacral promontory, right? So this area, so area between the upper border of pubic symphysis and the midpoint of the sacral promontory. So this is the true conjugate or anatomical conjugate and conjugate vera, and this measures around 11 centimeters, right? So next you come to is the obstetric conjugate. Now the obstetric conjugate, again this point will remain same whenever you are explaining the AP diameters of the inlet. This point will remain the same, midpoint of sacral promontory, and this point will keep on changing. So when we talked about the first diameter, it was from the upper portion of the symphysis pubis to the midpoint of sacral promontory. Now you come to obstetric conjugate. This is from the middle portion of the pubic symphysis. This is pubic symphysis, middle portion of the pubic symphysis to the sacral promontory. So this area, right? So and it will be around 10 centimeters. And third is the diagonal conjugate. It is from the lower border of the pubic symphysis from here up to the middle point of the sacral promontory. So this area, right? So this is around 12 centimeters. So now you have learnt about three AP diameters of the inlet: the anatomical or the true conjugate, the obstetric conjugate and the diagonal conjugate. So this will be 11, this will be 10 and this will be 12. Now out of these three conjugates AP diameter, it is only the diagonal conjugate that you can actually measure clinically. So how do you measure the diagonal conjugate clinically? When you do a pelvic examination, a per vaginal examination, PV examination, you put a gloved finger and you know, try to look for the sacral promontory. Normally whenever you do a pelvic assessment, generally you should not be able to feel the sacral promontory, or it should be felt with much difficulty. If it is easily felt, that means that there is inadequate pelvis, and the it could be a compromised pelvis for the fetus. So how do you look for a diagonal conjugate? A gloved finger, you do a pelvic examination. When you introduce it, right, the middle finger will touch or reach with difficulty to the sacral promontory, and the area on the thumb that is touching the pubic symphysis you will mark with a pen, right? Then when you take it out, you measure this area that is between the middle finger and the marked pen. This area will tell you the diagonal conjugate. When you subtract 1.5 to 2 centimeter from this diagonal conjugate, you will get the obstetric conjugate, right? So this is how you find the diagonal conjugate, and you come to know about the obstetric conjugate. So 11, 10 and 12, and you measure that, subtract 1.5 and 2, and you get the obstetric conjugate. Next you come to the transverse diameter. Now what is the transverse diameter of the inlet? The transverse diameter of the inlet is basically the difference, that is the distance on the farthest portion of the iliopectineal line. So here you have the iliopectineal line, the farthest portion will be this area. So the maximum difference, so this is around 13 centimeters, the transverse diameter, the farthest portion on the iliopectineal line. This is the transverse diameter. Then you have to explain the oblique diameter. So you have a right oblique diameter and you have a left oblique diameter. The right oblique diameter will start from the right side of the joint. When you place it in anatomical position, this is the right side of the patient, this is the left side. So the line joining the right sacroiliac joint, right sacroiliac joint to the prominence over here, this will be known as the right oblique diameter, right? And the one which starts from the left side, right, it will be known as the left oblique diameter. So this right oblique diameter, right from one sacroiliac joint to the opposite iliopubic eminence is right, and this to the left oblique iliopubic eminence will be left, and this is around 12 centimeters in measurement when you measure it. So these are the main diameters. There is one more diameter which is known as sacrocotyloid diameter. It is not of much importance, but since it's given you in your book, so let me tell you that the sacrocotyloid diameter is 9.5 centimeters, and it is the distance between the sacral promontory to the iliopubic eminence, right, from here to here. So sacrocotyloid, and it is 9.5. right? So now we are done with the diameters of the inlet of the true pelvis. AP diameters, 3 AP diameters, anatomical, obstetric, diagonal, then transverse diameter, and then right oblique diameter, left oblique diameter, and sacrocotyloid diameter, right? So this was 11, 10, 12, this was 13, this was again 12, and this was 9.5. So we are done with the measurements of the inlet. Now we come to the cavity. So when we come to the cavity is basically round in shape. It is a round cavity. So whenever you measure diameters of a circle, they'll be same. So it is easy to understand. The cavity being a round shape, the diameters of the cavity will be same. So what are the dimensions of the cavity? Whenever we talk about the AP diameter, it is a measurement from the midpoint of the pubic symphysis to the junction of the second and third sacral vertebra. So you have here second and third sacral vertebra. So mid portion of the pubic symphysis to the junction of the second and third sacral vertebra. So this is the AP diameter, and this is about 12 centimeters. Similarly, the transverse diameter of the cavity cannot be precisely measured as it is covered by soft tissue, right? Over the sciatic notches and the obturator foramen. So you cannot measure it precisely, but it is also 12 centimeters. So it is easy to remember the cavity के diameters. AP diameter 12 centimeter, mid portion of the pubic symphysis to the junction of second and third sacral vertebra, and transverse diameter again 12 centimeters. So we're done with the cavity. Now you come to the outlet. So whenever we talk about the outlet, this outlet is divided again into two. First is the obstetric outlet and second is the anatomic outlet. Anatomic outlet is this area, that is bound by the bony structures, this area. This is the anatomical outlet, and the obstetric outlet is the area present between the anatomical outlet, that is this one, and the area of least pelvic dimension. Now what is area of least pelvic dimension? Area of least pelvic dimension, it is the area basically between the lower portion of the pubic symphysis and the area between the tip of the fifth sacral vertebra. So if you have the last sacral vertebra here, so the area between lower portion of pubic symphysis and the fifth sacral vertebra, if you draw a line, the area that is present between this plane, right, and the plane below, that is actually formed by the bone, the coccyx, the ischium. So that area is known as the obstetric outlet, and this area actually formed by the bone is known as the anatomical outlet. So whenever we explain the obstetric outlet, I told you it is the area that is bound between the area of least pelvic dimension, that is formed between the lower portion of pubic symphysis and the tip of the fifth sacral vertebra and the anatomical outlet. And you need to measure the diameter. Again, the AP diameter, it extends from the inferior border of pubic symphysis to the tip of sacrum. Okay? So lower border of pubic symphysis to the tip of sacrum, AP diameter of the obstetric outlet. Then you come to the another diameter that is present here, that the transverse diameter, it is the bispinous diameter. This bispinous diameter, where is the spine? Here, I told you these are the spines, ischial spine. So the diameter between these two, right? The bispinous diameter is the transverse diameter of the obstetric outlet, right? And then third diameter is the posterior sagittal diameter. This posterior sagittal diameter, if you remember, it is good. It is the distance between the tip of the sacrum and the mid portion of the bispinous diameter. So if you draw a line between these two, bispinous diameter and tip of sacrum, say you bisect this line, so this much area will be found, right? Yahan se yahan tak. So this is the posterior sagittal diameter. So now we are done with the diameters of the obstetric outlet. Now we come to the anatomic outlet. Now this anatomic outlet is formed by the bony structure, right, that is present. It is bound in front by the lower border of pubic symphysis, laterally by the istiopubic rami, the ischial tuberosity, the sacrotuberous ligament, and the tip of coccyx. So actually the area that is formed below, so inferior border of pubic symphysis, then the pubic rami, then the ischial tuberosity, then the sacrotuberous ligament that is present between the ischial spine and this, and then the tip of coccyx. So this will form the anatomical outlet. Now this anatomical outlet again is diamond shaped, and if you talk about the AP diameter, it is again simple. So it will extend from the inferior border of the pubic symphysis to the tip of coccyx. Simple AP diameter. Lower border of the pubic symphysis to the tip of coccyx. Anatomical outlet AP diameter, and anatomical outlet AP diameter of obstetric outlet, lower border to the tip of sacrum. So simple. Now you're talking about anatomical outlet, so lower border of pubic symphysis to the tip of coccyx, that is the AP diameter, and it is about 13 centimeters. The transverse diameter, again very easy. So it is the intertuberous diameter, ischial tuberosity. The diameter, the line joining the two, is the intertuberous diameter, around 11 centimeters. And again the posterior sagittal diameter, 8.5 centimeters. Distance between the sacrococcygeal joint and the mid portion of the transverse diameter of outlet. So sacrococcygeal joint, and how we measure the transverse diameter of outlet, we'll let you know in some clinical class. So the area, the line joining between the two, that is known as the posterior sagittal diameter of the obstetric outlet, line between the sacrococcygeal joint and the transverse diameter of the outlet, and it is around 8.5 centimeters. So next I want to tell you about is the subpubic angle. The subpubic angle is formed, there's an angle formed here. It is formed by the two descending pubic rami. These are the two descending pubic rami. So it has formed an angle here. So in females it measures about 85 degrees. right? And then last of all, you have a pubic arch. So this is a pubic arch that is formed, and this area should be at least 6 centimeters for the pelvis to be adequate for the baby to pass. And you measure it clinically, it should be measured, you should be able to accommodate at least 3 fingers. So one finger is considered around 1.5 to 2 centimeter. So see, my 3 fingers are being accommodated here, so this pubic arch is adequate. So it should accommodate at least 3 fingers, and then you know that it is adequate for the baby to pass. So that is about the pubic arch. So I think this is all that you need to know about the female pelvis. Very quickly, I'll run you through it again. The female pelvis made up of 4 bones, 2 hip bones, also known as innominate bones, joined by 3 bones, ilium, ischium and pubic bone. Then you have a sacrum, and you have a coccyx, sacral promontory, ala, and the spines, right? You know all this. Then after that, you divide it into a false pelvis formed by the 2 iliac fossae, the lumbar spine and the anterior abdominal wall, and then rest of it is the true pelvis. Then you have the brim of the true pelvis. The boundaries I already told you. You have to sensible care, sensible care, and then tender love. Sensible care, tender love. So this is the symphysis pubis. Then you have the pubic crest, you have the pubic tubercle, you have the pectinate line, iliopectineal eminence, iliopectinate line, sacro-coccygeal joint or sacro-iliac joint or articulation, ala of the sacrum, sacral promontory. So this, then you come to the cavity. In the cavity is almost round in shape except for the concavity formed by the sacrum. And then diameters are AP diameter, transverse diameter, oblique diameter. AP diameters are 3. What? Anatomical or true conjugate, upper border to sacral promontory, obstetric conjugate, then the middle portion of pubic symphysis to the upper border of sacral promontory, and diagonal conjugate, the lower border of pubic symphysis to the midpoint of the sacral promontory. Out of these, the measurable is only the diagonal conjugate. You measure it by a pervaginal examination, subtract 1.5 to 2, and you'll get an obstetric conjugate. And the measurement of these 3 is, the first one is 11, the second one is 10, and the third one is 12, right? Then you have the transverse diameter, that is the maximum difference on the iliopectineal line, so it is around 13 centimeters. And then you have oblique, right oblique from the right sacroiliac joint to the iliopubic eminence, and similarly from the left, and is around 12 centimeters. And sacrocotyloid from sacral promontory to the iliopubic eminence, and it is around 9.5. So these are the inlet, the diameters of the inlet. Cavity diameters will be same, 12 and 12. So middle portion of the pubic symphysis to the articulation of the second and third sacrum, 12, and not able to measure properly because of the interposition of the muscles and all, again 12. Then you come to the outlet. Outlet is divided into 2 again, obstetric outlet and anatomical outlet. Obstetric outlet is between the least pelvic resistance, that is the lower border of pubic symphysis and the tip of sacrum, and the actually bony outlet. And the obstetric outlet, I told you again, AP diameter will be the same, the lower portion of this to the tip of the sacrum, and the transverse diameter will be the bispinous diameter, and the posterior sagittal diameter would be the tip the tip of sacrum to the bispinous diameter. So that was about the obstetric outlet. Then you have the anatomical outlet. Anatomical outlet, again the lower portion of the pubic symphysis to the tip of coccyx, this will form the AP diameter. The transverse diameter, the intertuberous diameter between the ischial tuberosity, and the posterior sagittal diameter, the line between the tip of coccyx and the transverse diameter of outlet. So that will form the posterior. Then you have the pubic angle, 85 centimeters. Then you have the pubic arch, at least 6 centimeters, and accommodating 3 fingers. So this is all I think you need to know. I've revised it almost twice. I just want to make a diagram so that you remember it little easily. Right. So if you make a box like this, right, and you write here brim, and you write here cavity, and you write here outlet, right? It's given in your book also, right? And then you write here AP diameter, and you write here oblique diameter, and you write here transverse diameter, right? So here you have written this. Now you write Sida. In this you write Sida 11, 12, and 13, right? In the next one, you write same 12, 12 and 12. And in the outlet, you start from ulta, from below up. So what will you write? 11, nothing here, and here you can write 13. Not much of an explanation in it, but it is an easy way to at least remember the measurement. So when you go through this, you will see that the brim or the inlet is almost round, except for the sacral promontory that is intruding. So here you have AP diameter, one of them is 11. Then obstetric diameter, AP I already told you, you have 3 in this, right? First I told you is anatomic or true. The second one is obstetric. I'm writing ulta, obstetric, and third one is the diagonal conjugate, right? So here you have is first one, this one will be 11, the obstetric will be 10, and this will be 12. The oblique is 12 and the transverse is 13. So this is how you remember. The second cavity, it is a round portion, it is a round in shape. So all are same, 12, 12 and 12. Then you have next is outlet. When you talk of outlet, there are two outlets. The obstetric outlet is little oval in shape, right? And the anatomical outlet is little diamond shaped, right? So in this, you start from below. The transverse diameter is 11 and the AP diameter is 13. So you can remember this box a little bit, and then you can apply it to your explanation when you explain about the pelvis. So I think that is all about pelvis. When you थोड़ा सा हाँ, when you ऊपर करना थोड़ा सा हाँ, when you read it in accordance with the fetal skull and the doll and dummy, you will be able to understand it better. Until then, you go through this video nicely, remember all the diameters and the lines, and it will be very easy for you to understand. And hope this class, you got to understand a bit from this class, and I'll see you in the next class. Bye till then.